there's something going on. These aren't just bad kids. ADHD is not just the result of bad parenting or a bad mother. Mothers got blamed for everything back in the day. And what we saw early mid 1930s is people starting to look at it as really a disease. So you can go through the history, but what we've seen, what's been interesting, is consistently the core symptoms have really not changed. In other words, people either they have a problem with staying on task, being inattentive, easily distracted, and then there's various sub symptoms, as it were. What's happened is ADHD was originally thought only as a disease of kids. So adults don't get up and run around their classroom like a hyperactive child might be. But those core symptoms were fairly similar. And what you see with adults is less of the hyperactivity. You see the impulsivity, but you also see this issue of what they call executive functioning. And what executive functioning is kind of the ability to plan your life and stay on task. So people who have difficulty with executive functioning kind of have a hard time finishing things through. You talk about adults with ADHD, they'll say, well, I have, many books in my library, but I've not read a single one cover to cover. They'll read the first few chapters and they get bored with it. So what we've seen with ADHD over about the last 10, 15 years has been some really elegant work in looking at the brain through advanced neuroimaging. And groups like Jay Geed, who was at the NIMH, now is down at UC San Diego, Javier Castellano, who's at NYU, and many others have really demonstrated that ADHD, if you really have the disease, really is a brain disease. So even in the size of the brain. So for a while, people thought, well, this is not a real diagnosis. It doesn't exist at all. And then others on the other side sometimes overdiagnosed it. And that's been a real problem with ADHD, is that, some people are just lazy, but people with ADHD are almost never really lazy. What they are is they have a hard time staying on task to finish. So, they'll multitask, but they'll never get to the end. That's kind of one of the common themes. So what we've seen over the last number of years is actually a change in the core diagnostic criteria to kind of define what a syndrome is. ADHD has been in there. And what we saw in the most recent iteration, the DSM-5, the fifth version of it, first one goes back to the 60s, really changed the criteria. So the original criteria that we saw up in like DSM-4 and 4TR, the previous iterations, said that you had to have symptoms prior to age 7. And because this is not something like a headache, that you get it, or other forms of psychiatric disorders where you might not develop till later in life. And what we've seen based on field trials and people who work in the field, so I ran an ADHD clinic when I was back in Philadelphia at Temple, was that there were people who had classic ADHD, but they didn't have evidence of symptoms prior to age 7. There's really not an adult form of ADHD. What you do see, though, is people who really don't kind of get into issues. Their families help them stay on task or whatever. It's not until they maybe even go away to college or later where they manifest symptoms. But if you get a good history, what you'll see is there are evidences of distractibility, impulsivity, difficulty staying on task when they were a bit younger. So there's a couple of issues going on. Why have we seen this dramatic increase? A number of people, a number of journalists have said, well, because the drug companies wanted to sell medications, the stimulants, as you mentioned, Adderall, which is a mixed amphetamine salt, or Ritalin, which is, in fact, it's interesting, Hubbard and the Scientologists, one of the first drugs they kind of went after, so to speak, was Ritalin. And what they said was that, here we're going to be grooming an entire generation of substance abusers. And people said, well, it kind of makes sense. These are drugs that are Schedule II. They have an addiction liability. But it turns out, if you actually do the studies, and Grabowski and Tim Willens and others have done the studies, it turns out that untreated ADHD in an adolescent is a significant risk factor for the development of substance abuse. In fact, when ADHD is treated as an adolescent, it goes down to essentially as if someone didn't have ADHD. So those things where over-treating it is not good. Unfortunately, it's been found to be a performance enhancer. So there've even been talk about having people before they take the MCATs or high-stakes exams to be drug tested. Over the last probably more than 10 years now, these are cash drugs on college campuses. Someone will pop a stimulant to pull an all-nighter to study for a test, to get in write a paper, whatever they might need to do. So there's been, and the biggest area of probably abuse and misuse has been largely on college campuses. Again, it's rather than drinking 7 cups of coffee, or having whatever hyper-caffeinated beverages might be popular, people would sell, they would sell their Ritalin or they would sell their amphetamine. And the 2 core stimulants are the dexamphetamines and the methylphenidate. And we've got many different kind of variations on those themes. And then you have some other non-stimulant drugs. The stimulant drugs have pretty consistently shown to be the most effective. It's not that the other drugs don't work, but the stimulant drugs seem to have the best effect, and particularly when used properly. Again, the problem with these and why they're monitors are these can be drugs of people can abuse them. Why there's an increase? I think it's a combination thing. I think there was greater awareness. That you so advertising was out there. Physicians were being educated more about the illness. So I think part of it was an increase in awareness. I do believe there's probably some reality that people were, anybody who couldn't stay on task, was, it's just ADHD. I remember early in my career, I did work in PMS, premenstrual syndrome, and it was like, well, any woman who was a little cranky, they said she had PMS. Well, clearly not. The term was used too loosely. So I think if in fact you follow the diagnostic criteria that we know exist, you probably have seen a slight increase, but not the dramatic increase. So I think it's what it comes down to is making sure that you go through the diagnosis, and the diagnosis of ADHD actually requires that you corroborate some of the data with family members or coworkers. It can't just be taken by history alone. So I don't know if the role of the stimulants. Again, they're the most effective drugs, but they have the highest abuse liability. There are other drugs that are effective, maybe not quite so much, but they don't have the abuse liability. So the balance is, like anything in medicine, it's what's going to be the most effective with the lowest side effect profiles. You want to maximize positive life experiences and minimize or eliminate anything that might be a negative.
Yeah, so I've interviewed a brother and sister who both have ADHD, and they told me that their dad also has ADHD, and to me, anecdotally, kind of proved the genetic, hard biological basis for this difference in what we call a disorder. But I also talked to another guy who was telling me how when he was prescribed Adderall in college, it was his freshman year of college, and it seemed to be a very straightforward process. Because I was kind of curious about the potential for abuse and people trying to get it on college campus, trying to get a diagnosis, and then obviously becoming reliant on it. And that I don't think that's something that we want. I don't think the number of people doing that is exceedingly high. But do you think that? And it sounded like the process that you described would be much more thorough than the process he described at our health center to be prescribed. So is there difference in the criteria there, or between from doctor to doctor, or is it, how would you describe that?
Well, there shouldn't be. So first of all, the genetics. So it turns out that ADHD is one of the most genetically loaded of all the psychiatric illnesses. It's about the same as eye color. So we've known now for quite a number of years, at least 2 or 3 decades, and you can do those studies, that it clearly runs in families. I can tell you, running an ADHD clinic, it was rare that I would find someone who I would see who didn't have at least one parent who had ADHD. Sometimes people have more severe forms of it, less severe forms, but it is highly genetically loaded. Mm-hmm. So that we know for a fact, and this has been well documented. And in fact, they've identified there's over 25, 28 genes. It's not a particular single gene, but it's what we call fate genes. So there's certain illnesses, if you have the gene, you're going to get the illness. Mm-hmm. Huntington's disease, Tay-Sachs. What we see in most of psychiatry are what we call complex or candidate genes, where it's a number of genes that you have that puts you at greater risk. And this is what we see with ADHD. And again, many of the genes that we know are very relevant in developing the illness have to do with the dopamine receptor. And that's why the drugs that are effective for ADHD tend to work on that dopamine system. The second question you ask is a very important one, and that's the one of doctors, particularly on college campuses, not really doing the appropriate workup and then writing a prescription. So the addiction you see, it's not really addiction like someone gets with heroin or other drugs of abuse, but it is a drug that has an abuse liability. Just anecdotally, so there are a number of professional athletes who used to be on and were on as performance enhancers. They would pop a stimulant before a game, and it would allow them to focus better. And what's happened over the years is the professional sport leagues, certainly in the United States, what they do now is if you want to take a stimulant, which is a banned substance, so if you test positive for it, it's the same as testing positive for for heroin or cocaine or other banned drugs, is now you have to go through an evaluation. Now, it used to be any doctor could do the evaluation and write you the script, and then you would get what was called a TUE, a therapeutic use exemption, which means you were taking the drug for medical reasons. Mm-hmm. What the leagues found out is that there were some doctors who were maybe, we're not doing what a good doctor should do, and they were just taking a quick history and writing it. So now, for example, the National Football League, you have to be certified. You have to go through certain training, and only certain doctors are permitted to do the evaluation. So I'm one of those physicians, and it's the training was quite good. And plus, you have to contact a family member. The sports leagues actually now require, certainly the NFL, a very comprehensive and appropriate workup. The problem we see on college campuses is some of the folks working in the Student Mental Health Center are a little too quick on the trigger to prescribe someone, which oftentimes are sold. Again, it's a cash cow. Mm-hmm. I've had lots of students over the years who said, I go away to college, I can, $25, $10 or whatever, I can sell, an Adderall or a Ritalin tablet. I know even at our own health center at USC a number of years ago, I was asked, I went down and talked to the counselors and the physicians down there about ADHD on the college campus. So I know USC takes this seriously. It can have cardiac effects, and there are drugs that every drug has a side effect, and the stimulants certainly have their own. Mm-hmm. I think one of the problems we've seen on college campuses, really across the country, is this issue, as you raise, of people going in, maybe getting a 15, 20-minute interview and then being handed a prescription. And that's really not appropriate. That clearly is not following the established diagnostic workup that really one should go through, particularly in potential at-risk groups. By at-risk, we mean college students are at risk to want to maybe be motivated to use the drug for something other than ADHD, and we call that non-medical use. Mm-hmm. The other thing we see it for is they take away appetite. So it's a drug that, particularly this time of year when you're getting into springtime, in most campuses, somebody wants, men or women want to drop some weight. The stimulants take your appetite away. They give you a little extra, so they've actually been misused as well as weight loss agents.
In addition to that, on college campuses, I've anecdotally seen people that have been prescribed Adderall when they don't need it. And a couple of the people I talked to described other people they know that sought out a prescription not having ADHD, but using it primarily for scholastic purposes to be able to focus, and they were able to get the prescription. So it seems like if somebody wants this, it's fairly easy to go in and fill out a questionnaire, which it's easy to read the questions and know what you should say, and then be prescribed. So I guess actually going through the family history, seeing if there is a family history, and then corroborating it with fairly more objective measures, I guess, seems necessary. But I guess that's not necessarily happening at the health centers, specifically at USC from what I've heard anecdotally. And I've also heard of people mentioning the beneficial effects of using it for weight loss as well. I'm pretty sure amphetamines were prescribed to women as a weight loss drug at one point. You mentioned kind of the side effects. Go into a little bit more the side effects for people with ADHD versus people without ADHD. For people with ADHD, there are very different mental side effects than people without ADHD because they're bringing them to a neurotypical state when you have ADHD, whereas if you don't have ADHD, they're bringing to a super physiological mental state.
Yeah, and that's one of the, so we're pretty clear about what the side effects are. In fact, early on, remember, it wasn't, I said, till the 70s that we saw this as an illness of potentially, and it's probably around, depends on who you read, probably 30 to 40 thereabouts, maybe even as high as 50% of kids and adolescents who have this will have the same kind of full-blown ADHD as adults. What we're seeing now is there might be maybe slightly higher, but there are a couple of kind of paper and pencil tests. The ASRS is one of them. There's a number of them that are out there, and these are not diagnostic instruments. These are really symptom screeners. And the problem with clinicians who don't really fully understand, or maybe taking some shortcuts, is you can fill these things out, and it's only one piece of a much bigger puzzle. So Len Adler, he and Ron Kessler have developed one of the most commonly used one, and Len's a friend and colleague of mine, and he said one of the things that really bothers him is that, and he's the guy that developed this instrument, is that people don't realize this is only one piece of that diagnostic puzzle. Things that you have to have to warrant a diagnosis, like corroboration from someone else, usually parents, friends, co-workers. It can't just be someone's history. Plus, you have to have documented history of symptoms going back to, even by DSM-5 criteria, age 12. And none of those are kind of gotten on the paper and pencil test. So the paper and pencil test is really only one piece of the puzzle. And one who just does those and then writes a prescription really either doesn't understand or is not practicing, quality medicine. And again, on college campuses, when sometimes it's very busy, people might feel overworked. There might be the sense, well, if they scored positively on this test, the paper and pencil, then they must have it. And that's not true. That's someone who either doesn't know the criteria or is taking a shortcut on that. As far as the side effect profiles, those we've known for a very long time. So some of the most common ones are it does take your appetite away. In fact, one of the issues they used to talk about years ago when treating kids with ADHD is the kids would lose their appetite, so they'd stop eating. So that when you're a child, that would then slow your growth down. So the concern was that, well, if you're on stimulants all the time, you're going to end up being a smurf, a short person. And that wasn't really true, because when you stop taking them, the appetite comes back, you eat normally, and your growth comes back. But it does take away appetite. In fact, they used to call medication holidays, give them the weekends off. The problem with that is ADHD is not just a disease or an illness of the classroom. These kids wouldn't get invited over for sleepovers because the little boys couldn't sit still. So the idea that ADHD goes away when school goes away is just not right. So you have to treat it, whether it's medications or other forms of treatment, all the time. So we have weight loss, loss of appetite, increase in irritability, and as you said, people who don't have ADHD tend to get more irritable. They get, because it is a stimulant. That's what the drug does. Headaches are fairly common. Increase in heart rate. One of the things athletes would say, and there are many athletes who really do have ADHD, even legitimately so. I've taken care of athletes for many, many years, is they'll report that they're aware of their heart pounding harder. Their pulse will go up a little bit. Now, if you have ADHD, it goes up a little bit. Years ago, not that many years ago, they used to say, well, you really should get an EKG to kind of monitor the normal heart functioning even before you start these medications. Now, the American College Child and Adolescent Psychiatrists and other groups have said if there's a family history or there's other cardiac issues. So cardiac, it's diet, it's loss of weight and loss of people just aren't hungry. They just people get a little stomach upset, mild. It's not like they're walking around vomiting all the time. So increase in sweating. A real important side effect that affects people is it really screws up your sleep cycle. It's a stimulant. It's like someone who's sensitive to coffee having a cup of espresso right before they want to go to bed. They're not going to be able to fall asleep. And this is an issue. So it's both a side effect and something that college kids will sometimes want to use as a therapeutic effect for them. Let me sleep all night. You can pull all-nighters with it. So in fact, most of the stimulants, the problem with them is that you can't take them in the evening because they'll disrupt sleep. What we've seen, some of the advances in the medications over the last 15, 20 years, well, not 20, maybe 15 years, are medications that are more slowly onset and a slow offset. So you can take them once in the morning, but they're out of your system by 8, 10 o'clock at night. Ritalin is a very short-acting drug. So if you took it after, say, 4 or 5 o'clock in the afternoon, early evening, it could have an impact getting to sleep. Now, again, a college student, that might be what they're looking for, but we consider that a side effect profile, for people who say, geez, you can't fall asleep.
But another thing that I think that people kind of have as a misconception is that technology and social media is increasing ADHD. And from what you've described, if it's a genetic-based disorder that you're essentially born with, difference in neurological predisposition, then social media couldn't be increasing ADHD. It might increase lack of attention within normal bounds, normal physiological levels, and it may exacerbate the symptoms of ADHD itself with people that have it, but it's not going to increase the number of people with ADHD.
That's exactly true. What you see is when there's increased awareness of something, and I've seen this a lot. I've had, when I was back in Philadelphia at Temple University, when I was even at USC, what you would see is someone who would read about it or see a TV show or something, and they'd come in and say, I always just thought I was lazy. It's like people didn't know. It's not an illness that you can't live life with. People they'll lose their keys, they'll forget to call you back. It has a significant impact. Interestingly, adolescents who have ADHD are much more likely to start smoking. They start smoking younger, and they have a much more difficult time stopping smoking. I used to go to the Stop Smoking program at Temple, and anyone who had failed 2 or 3 attempts, we'd do an evaluation. Oftentimes, they had ADHD. So this isn't like an illness. Like when you're depressed, people know, I can't eat, sleep. But people can go on for a very long time with ADHD, and because it's not an episodic disease, by that I mean when you're depressed, you have periods where you're really down, but then you'll feel a little bit better. ADHD is kind of there all the time. So people who have ADHD, it's not like, 3 days of the week they're perfectly fine, they can stay on task, and then they have a couple of days where they're not so good. It's just who you are. It's kind of like part of your personality, so to speak. So what you see with some of these awareness is people who literally have had it, and and I've seen this a lot of parents. I'll evaluate their children or an adolescent, and the mom will come in and say, that was me when I was younger, but they were never diagnosed. So there was actually, it wasn't that it was overdiagnosed, it was probably fairly significantly underdiagnosed in the past. What media does is it makes people aware, but as far as social media or the internet being a cause of it, no. This is a biological disease. We know what's going on in the brain. We can now measure and look at the brains of folks with ADHD. In fact, there was another group came out just a few months ago. The NIMH, Judy Rappaport's group, did a lot of the really early work, and others across the country. So this is brain disease. This is not a disease of bad moral fiber. It manifests itself a little differently. So, for example, girls tend to be a bit more, distracted. They'll sit there, the little girl will sit in class and kind of daydream, can't stay on task, where in general, little boys tend to be a little on the hyperactive side. They can't sit still. They're more like the fidgety Phil. As we go older, and those who continue, the 50, 60, 70, whatever percent, the adult form seems to be a bit less hyperactive and more of this executive functioning. What adults get is they have a hard time like sitting still. They don't like waiting to go to the store and there's a long line at Costco or at the supermarket or Walmart, and they can't wait in the line. They'll just leave. So that's the impulsivity piece. So you're right that this is not caused by any social media. This is not caused by any. This is a disease that like many other things, if you have the genes for it and the circumstances, and there have been some folks who are very high functioning ADHD. So this isn't necessarily everyone who's got it. Is going to be a dropout. It is true that if you look at the data, Russ Barkley has written a lot about this and done some really good work in longitudinal studies. is that ADHD, folks with ADHD will sometimes, it will take them a bit longer. Oftentimes they'll take 5 years to get through college. They're certainly not any less smart. It's just like, get the paper due on time. They don't get to register, so it's things associated with the symptoms. It is not a problem with not being intelligent. It is a problem with being able to follow through and stay on task. Anybody that says, well, it's watching too much TV, no. Watching too much internet, no. This is a disease that if you have the genes, you're kind of born with it. And then why some people get more significant symptoms than other illness, hypertension, diabetes, it's not just looking at psychopathology.
Right. I think that makes a lot of sense. With some people, it's sort of the effect of reading the symptoms on WebMD and thinking that you have cancer. So you probably see some parents with kids.
Exactly.
Definitely, yeah. Definitely.
That's exactly right. They used to call it medical students' disease. And what that meant is medical students, every disease they were learning about, they had they'd be reading about brain cancer. So we have headaches. Oh, I had a headache. I must have brain cancer. So you're exactly right. As people learn more about, well, yeah, I did lose my keys last week. Maybe I'm ADHD, or I do have a problem getting my taxes in on time. So you're right. People kind of self-diagnose, and if you have one or two symptoms, that does not make for ADHD. Again, this is why of all the illnesses, this is one of the most important as far as getting a good evaluation by someone who really does know what ADHD is, and just as importantly, what it is not. So the importance in this is making the diagnosis accurately and effectively by someone who really understands. This requires a much more thorough evaluation than almost anything in the area of psychiatry or mental health.
Just a better education maybe for doctors that are prescribing in college campuses might be necessary. I don't know if that's already taking place or...
Well, hopefully, like I said, a couple of years ago, I got invited down to the Engelman Center, and I did a presentation, and it was, had a good time. They were good people. I know they're good. I know they've hired a whole bunch of new doctors down at the counseling center, which is a good thing. But I think the core point is good education. ADHD, it's, you can get a single lecture to kind of know what it is. But I think you're right. The important issue is really good education of the people making the diagnosis, making sure that it is ADHD. Interestingly, folks with ADHD have a higher comorbidity, so they have other issues. The person will have either a comorbid anxiety or a mood disorder thing that will drive them into treatment. And it's a good experienced clinician who needs to say, okay, yes, you've got depression or anxiety, but making sure ADHD it isn't kind of a driving engine, because what we found is that you really need to, it's like anything else. If you have diabetes and hypertension, you need to treat both of them. You can't just treat one. So it really gets down to good education. In fact, earlier on in my career, I did some work with the California Academy of Family Practice, and many family physicians are, that's who's, they're doing the initial workup on it. And it was a wonderful program that we went around and spoke to many of the family doctors, and so they felt more comfortable in not only diagnosing but appropriately treating ADHD. So, for example, the data on depression, there's actually very good data to show that many people don't need to be on antidepressants. That doesn't mean that they don't work, and that some people could, but there's very good data to show that psychotherapy, for example, can be an effective treatment for many people with depression. Not all, but for many. It turns out if you look, ADHD is one of those things where psychotherapy does very little to treat the core symptoms. Not that psychotherapy might not be helpful. In fact, they have what they call ADHD coaches, which be quite beneficial. Forms of psychiatric disease, ADHD is one that if you make the proper diagnosis, you do the appropriate workup, that medications are really, they're the treatment of they treat the core symptoms. Now, whether it's the stimulants or the non-stimulants, there are a number of non-stimulant medications that are FDA approved. But to have ADHD be diagnosed and not consider a medication trial is really not consistent with what we know to be the most effective treatment. So you're right. And people will say that when they're on the medications, they do well, they're able to be normal. But when they come off them, oftentimes people will say, geez, here it has significant negative life events. I can't stay involved in a conversation. I keep forgetting things. I lose things. I can't stay on task. So I think it's an interesting paradox that this is a disease. It is a disease of the brain. We can measure the changes in ADHD brains versus non-ADHD. That medications, but the appropriate use at the right dose is really kind of the keystone of good treatment. I mean, the answer to be whether to treat, whether it's meds or other forms of treatment, that answer should be based on a good workup. In other words, not just a brief 10 minutes, you've lost your keys or your grades are dropping down or whatever, and then writing a prescription. It requires good education, and I'm sure it will help make a contribution to that. So best of luck with it, and best of luck with the rest of your career as a Trojan.